As a young citizen of India, armed with technology, knowledge, and love for my nation, with a vision of transforming India into a developed nation, I'm joining Shobhit University. What about you?
Very good morning to all the participants from India and abroad, from Shobhit Institute of Engineering and Technology, Meerut, deemed to be university, and its centers of excellence, Center for Informatics Development Solutions and Applications, CITSA, and Center for Industry 4.0 Technology Studies and Applications, CITSA. Welcome our guest speakers of today's webinar, Mr. Nilesh, Kanade, founder and chairman, eHealthSystem Technologies LLP, Pune, Maharashtra, and Chief Executive Officer, eHealthSystem Healthcare LLC, U.S.A. And the participants from India and abroad attending this webinar. International webinar series on open source digital technologies towards self-reliant India, Atmanirbhar Bharat. Today, 6th February 2021. Under this international webinar series, these two centers of excellence, Center for Informatics Development Solutions and Applications and Center for Industry 4.0 Technology Studies and Applications, have organized 21 lectures so far. Open technologies to provision simple and economical IT infrastructure. A roadmap for students using free and open source software and reaching goals of Atmanirbhar Bharat. Open source software and industrial IoT for SMEs. Free and open source software adoption and business models. Open data platform for smart digital government. Technology imperatives. Make in India for self-reliance. Edge artificial intelligence. Data government for self-reliant India. Digital India transforming governance and society. India's email service citizen@indiamail.com in 22 constitutionally recognized languages. Ecosystem architecture for digital transformation. Education system cyber critical infrastructure. Seizing opportunities in open innovation and value creation network in the digital world for self-reliant economy. Open innovation in clinical research and drug discovery and eHealth system is very important. Ensuring food safety and compliance through technology. Digital India, urgent need for semiconductor manufacturing in India. Technology investment in agriculture value chain, role of foreign direct investments, entrepreneurship and skill development, artificial intelligence design pathways, the rise of platform economy, revisiting value chain governance, the era of automation, industrial robotics, industry 4.0, Indo-German perspectives of technology transfer, skill gap analysis and opportunities, the role of artificial intelligence in healthcare, current developments in diagnosis and vaccine research, digital agri-tech and agri-startup perspective. Today is the 22nd edition of this very important webinar series. We will have the talk by an NRI entrepreneur, Mr. Nilesh Kanade, who builds a customizable eHealth system for the world. On the topic, Health Informatics Network Value Chain, a eHealth system and beyond. eHealth, digital health, one nation, and health informatics network, and so on and so forth. These are all the keywords now after coronavirus, took place in this country. Topic in the webinar series is a growing list. Technology imperatives, technology investment, open technology, open system, open infrastructure, open source software for open infrastructure, open hardware for open infrastructure, open data platform, open banking, open insurance, open innovation, value creation networks, human resources development, entrepreneurship development, skill development, startups in open technology applications, open society, industry 4.0, pharma 4.0, textile 4.0, agriculture 4.0, industry 5.0, mass customization, and cyber physical cognitive system 2020. That means co-working of man and machine interface, edge computing, data governance, digital India, India email service, open digital ecosystem, cyber critical infrastructure, dark data, dark cloud, dark web, dark net. Technology enabled food value chain governance in platform economy, urgent need for semiconductor manufacturing to make digital India. Atmanirbhar Bharat is the road ahead. It is our Honorable Prime Minister, Mr. Narendra Modi's 5 eyes to make India self-reliant economy. 5 eyes are intent, inclusion, investment, infrastructure, innovation, based on 5 pillars. Economy, quantum jump. Infrastructure, one that represents modern India. Systems, 21st century technology driven, vibrant demography. Demand, whereby strength of our demand and supply chain should be utilized to full capacity. This was announced on 15th May 2020 by the central government. Vocal for local to make it global, a demand-based economy system which is self-producing and self-consuming. Make in India, make for India, and make for global. In 2021-22 Union Budget, the Government of India has announced the setting up of National Institution for One Health at Nagpur. Scientists say that there are about 830 diseases that can originate in animals and transmit to human. Databases, registries are important for the future course of action. Once again, scientists say that there are about 830 diseases that can originate in animals and transmit to humans. This, present situation, COVID-19 pandemic situation, is due to one such disease from animal, from Wuhan in China. Digital world, the rise of platform economy, application of big data, new algorithms, artificial intelligence, blockchain technology, open API, and cloud computing is changing the nature of work and the structure of economy. Digital platform economy is encouraging and emerging. Digital ecosystems are essential for digital transformation in the digital world. Mr. Nilesh, can you come on video? Digital health system. Digital health is a multidisciplinary domain involving many stakeholders, including clinicians, researchers, scientists, with a wide range of expertise in healthcare, engineering, social sciences, public health, health economics, and data management. The 3 most popular domains of digital health technologies include telemedicine, wearable technologies, and augmented and virtual reality. Computational simulations, modeling, and machine learning approaches can model health-related outcomes very effectively. Digital health platforms continue to emerge and evolve. One Health, EcoHealth. FHIR is a standard for healthcare data exchange published by HL7. Digital health means artificial intelligence and machine learning based on platforms that aggregate patient data. A digital healthcare ecosystem is an infrastructure that supports the shift from an organization-centric to a patient-centric model of delivering healthcare services using digital platforms. National Digital Health Mission of India, One Nation, One Health, aims to streamline digital health ecosystems in India. The One Nation, One Health card will digitalize the health records of all Indians, making patient data accessible and inclusive in one card in a very secured manner. National Open Digital Ecosystem Node in Health. Platformization and National Open Digital Ecosystem can unlock, means digital health platform and National Open Digital Ecosystem can unlock economic opportunities worth of $1 billion, according to a study by management consultancy BCG and impact investor ODR Network India, September 2020. National Digital Health Blueprint 2019 recommends that a federated architecture be adopted instead of a centralized architecture for the management of digital health data to ensure interoperability, technological flexibility, and independence across the national digital health ecosystem. Integrated farm health management system for reduction of farmers' loss. The Doubling Farmers' Income by 2022 Committee Report 2018 has suggested in volume 12B strategic use of digital technology in farming system life cycle through 7 mission mode programs, out of which one, Mr. Manish, out of which one is dealing with digital farm health management for reduction of farmers' health, the farmers' loss, which includes farmer health, plant health, animal health, soil health, water health, and fishery health. Government of India has established National Animal Disease Reporting System, NADRS, during 2012 by networking about 7,032 locations in the country to monitor about 144 OIE notified diseases. And it has got National Animal Disease Reporting System has its objectives and features. Today's topic is Health Informatics Network Value Chain, eHealth systems and beyond. What do you mean by Health Informatics Network Value Chain? Human health, plant health, water health, marine health, animal health, soil health, and air health. Indian healthcare system includes allopathic system of medicines, Indian system of medicines, Ayurveda, Siddha, Unani, and homeopathy. Central government is formulating an integrative health policy, One Nation, One Health System by 2030. That would integrate the modern and traditional system of medicine such as allopathy, homeopathy, and Ayurveda in medical practices, education, and research. One Health, Eco Health aims at strengthening the links between human health, animal health, and management of environment, plant, animal, fishery, soil, and water. The Doubling Farmers' Income by 2022 report recognized Integrated Farm Health Management System, Volume 12B, Chapter 10. Health Informatics, as established, uses information technology to organize and analyze health records to improve healthcare outcomes. Health informatics has emerged as an important informatics discipline of late, encompassing the disciplines of artificial intelligence, big data analytics, cloud computing, blockchain technology, social networks, mobility, Internet of Medical Things, Web of Medical Things, biological computing, geomatics, and bioinformatics, etc., leading to new medical treatments and new diagnosis. Bioelectronics, applications of principles of electronics to biology and medicine is likely to be a cost-effective and reliable technology for a society 5.0. Digital health startups are bringing novel technologies such as wearable technology, telemedicine, genomics, and artificial intelligence to the Indian healthcare system. Fourth industrial revolution, namely Industry 4.0, is the ongoing automation of traditional manufacturing and industrial practices using modern smart technology. Key technologies are artificial intelligence, analytics, operational research, blockchain, cloud, IoT, 5G communication, big data, and ecosystems. Industry 4.0 is today. Industry 5.0 is tomorrow. Artificial intelligence is revolutionizing healthcare with game-changing capabilities. Health systems that have strongly invested in digital health will be the first to realize artificial intelligence innovation. No data means no artificial intelligence. Poor data means poor artificial intelligence. Artificial intelligence have got 6 major components: natural language processing, symbolic artificial intelligence, and computer vision, machine learning, speech processing, and robotics. Use cases inspired by ethical, social, and political challenges of artificial intelligence in health. Artificial intelligence solutions to monitor and assess the health of a human population in order to select and target public health interventions based on AI-enabled predictive analytics. AI technologies, especially neural networks and deep learning to assist drug discovery and design, uses Onyx technologies for personalized therapy and deploy AI tools for clinical trial design and execution. AI-enabled clinical care pathways are novel technologies that fit AI-based solutions into existing and new clinical workflows, such as for diagnostic or prognosis purposes. AI-enabled patient-facing solutions that uses AI to interact directly with patients with other users, including the delivery of non-clinic therapies, chatbots, personalized health advice, interventions without risk for harm, and information provision. AI-enabled optimization of health operations. Some of the most COVID searched words in the last year were healthcare, pharmaceuticals, vaccine, and COVID. The global awareness toward medical diagnosis and vaccine research is at its peak due to the impact of pandemic. As such, we see many companies, startups, and institutes launching their innovative healthcare technologies driven by artificial intelligence. Two of the numerous advantages of artificial intelligence are scaling up of technologies for mass population and shorter time and span of pharmaceutical drugs from the lab to the market. Let us now turn to the address of Health Informatics Network Value Chain, eHealth System, and beyond by Mr. Nilesh Kanade, our guest speaker today. Mr. Nilesh Kanade, please come on video. In this talk, Mr. Nilesh Kanade will highlight creating health information exchange and also health informatics network value chain. The foundation seed for health informatics network was shown during 1987-90 under the front runner of the present day e-governance program, District Information System NIC, District Health Database Development Program. This topic will motivate and galvanize the participants watching our telecast through facebook.com/Sobit University India or youtube.com/Sobit University in for motivating them to establish startups in healthcare to strengthen health informatics of the country. Let me introduce our guest speaker, Mr. Nilesh Kanade, to the participants of the webinar. Mr. Manish. Mr. Nilesh Kanade, founder and chairman, eHealthSystem Technologies LLP Pune, Maharashtra, and Chief Executive Officer, eHealthSystem Healthcare LLC, U.S.A. Mr. Nilesh Kanade is a visionary entrepreneur who built his career from modest beginnings. Through effective business planning, creative techniques, innovative ideas, and in-depth knowledge of a diverse business environment, he succeeded in leading a company globally. Mr. Nilesh Kanade's articulated vision encompasses personalized healthcare for individual needs, ensuring the highest standards of quality while maintaining affordability. Mr. Nilesh Kanade endeavors to strengthen the base of healthcare services by bridging the gap between the latest global research innovations, health data, and clinical applications. His personal mission is to improve the health of an individual by fostering an environment and doorstep services through personalized healthcare. He is committed to generating value for society in fundamental and advanced arts, science, and technology. Mr. Nilesh Kanade, we welcome you to the International Webinar Series on Open Source Digital Technologies for Self-Reliant India, Atmanirbhar Bharat, Health Informatics Network Value Chain, eHealth System, and beyond. Over to Mr. Nilesh Kanade for your address. Over to you.
Good morning, Professor Moni sir. It's my pleasure to be on this webinar today and understand your perspective, understand how the Atmanirbhar Bharat can be supported with our initiatives and how it can also create a pathway for global entrepreneurs as well as governments as well as citizens in this COVID and post-COVID scenario, as you very rightly mentioned, that we need to look at things with a holistic approach. We need to see things with new facets wherein all the connecting dots, if connected accurately, there can be a very positive outcome, utilization of the resources, and preparing ourselves for any futuristic healthcare situation. I am CEO and founder of eHealthSystem, which the journey began almost 10 years back when WHO passed one resolution in 2010. It was considered as a first prima facie document for understanding health information exchange. They decided Vision 2020 and the resolution was passed envisaging that how almost 195 plus odd countries and governments should understand the meaning of health information exchange, utilizing their resources, upgrading their health care infrastructure, interconnecting, creating interoperability, and unifying the healthcare ecosystem. In totality, the impact would be empowerment of the citizens. So this whole process, I still remember when I was understanding it in the very initial stages, wherein surprisingly, health is considered to be a very less and last priority. Even in the developed nations, even in the underdeveloped nations, it's a human psychological process that my health is going to be taken care of without any much additional efforts. On a personal level, even before COVID, the understanding globally was it's okay, it's okay. My health, it's okay. My other things are more tangible, and my health is having a less priority while going for health insurance, while treating oneself, while having preventive health care provisions, etc. So, when some of my associates and myself, we were discussing this in New York, Dr. Joseph Anton, Dr. Raja Kamal, Dr. Mukund Chorghate, associates from US, associates from India, and we all thought that there should be a digital platform based on WHO's guidelines, based on the resolution which was passed, and the bubble plan was created, that how technology, people, governments, citizens, patients, and healthcare ecosystem can be, should be interconnected, creating health information exchange as well as health informatics value chain, and how it can enhance the personal health as well as national health as well as global health, and as well as increasing SDGs, sustainable development goals of every nation, and how it should decrease the disease burden on underdeveloped countries as well as the developed nations. So the initial idea of health information exchange and how it can be connected to the cloud, how simple technological solutions can be installed, and how this entire system should work with absolute ease, and then how we can convert all these thoughts in some kind of usable devices. Many a times beautiful ideas, many a times beautiful concepts, the value of those concepts and those ideas need to be converted into pragmatic usability, utility. The outstanding research of any researcher or any scientist should be able to see the utility, the implementation, and how the people can be benefited at large. So we started this roadmap, this blueprint. It took us 5 years to create a system which we call as eHealth system. It's a platform. It's a digital platform wherein we can connect, we can communicate, we can unify, we can create interoperability, and with security measures, utmost security measures, though there are laws like HIPAA and EMR guidelines and security guidelines based on HIPAA globally. But again, as I said, all these things need to be put in a shape, put in a channel. All these energies, ideas, dreams, entrepreneurships should be channelized, and it should see the implementation process, and it should be rolled out. So there is this system which will connect. This system will be adapting. We see a lot of challenges where A class infrastructure is available, where it is possible. As soon as you go little down, B class environments, cities, C class towns, D class smaller places, E class. There are thousands of villages in India below 1,000 population, wherein digital health, physical health, a doctor is not been seen in last 70 years. A physical doctor is not present in thousands of villages below 1,000 population. So, all this system, when we made it ready, HIPAA compliant, then we thought we should convert and deliver it in some kind of mobile apps, Android apps, iOS apps, health cards, boys and girls who are going to the school and do not have mobile phones, they should have wristbands wherein the data can be stored. And this health card, this health app, this health band can be connected to the cloud, and that cloud is connected to the dashboard, and that dashboard is a real-time dashboard for the government for analytics, for creating the data, for giving real-time solutions to the people, to the citizens, and trying to understand the population health management. So I would like to show some slides and a short video to make you understand how the thought flow and how this entire process we started and how we would like to offer. So initially I would like to show you a small video which can give you a fair idea. Just a moment.
Mr. Nilesh. Hello?
Yes.
In
Yes,
the
sir.
share button, you please, and below this screen, there is a share button. If you click that share, it will come share share slides or video. The video button, click and then click the concerned video. It will come. It will play. Okay. Or you can send the video to me. I will play it from here. Then you can cover with the
Yeah.
PowerPoint presentation. You forward to that video to me through WhatsApp.
Yeah.
Hi there.
Or shall I show the slides which you have sent to me from my side? You can speak. It's coming.
I'm sharing this video.
Okay, fine. It's coming. Run it.
I would like to share the slides, how we are planning, how we all together should make Atmanirbhar Bharat better, as well as how we should give global solutions in the form of vaccine tracking, citizens tracking, data analytics, using AI to provide solutions. When we have better data, we have better policy making. We have better policy making, we can provide better implementation of the policies. I would like to show some slides and explain our approach.
Please put your video also on. It's coming.
So this is eHealth systems basic understanding, that what we will be offering is a system which is unified, connected, interoperable. And as we all are aware, security aspect is very, very pivotal. So, considering the necessity as well as security, the fundamental idea is a unified, connected, interoperable, secured healthcare delivery system.
It's not moving. Mr. Manish, can you run from your system?
I have sent it to you.
Yes, sir.
Yeah. Okay, please. You run from your system, and Mr. Nilesh, our guest speaker, will talk on those slides. When he says next, you then move to the next slide. Okay.
Sir forwarded to you, I think, sir. Sir forwarded
Okay.
to
Then
you.
I'll forward to you. Just 1 minute.
Okay, sir.
Or I'll run from my system. Okay.
Yes, sir. Yes, sir.
Mr. Nilesh, can you ask them to come out from your side? Okay, fine. Just 1 minute. Is it visible? Hello?
It is.
Yes, sir. Open the PPT now.
Hello?
Yeah.
No, sir. Share again, sir. Share again.
Okay.
Sir is showing.
Okay.
Open the PDF now, sir. Open the PDF.
Okay. Mr. Nilesh, is it visible there?
Sir,
I'm
your
not
screen
able
is
to see it,
visible,
sir.
but sir,
Hello?
open the PPT or PDF file, na?
Now, this is PDF file.
No, sir.
I will send it to you. Just 1 minute.
Just send it to me, sir.
Okay. Mr. Manish, I have sent it to you. Mr. Manish?
Sir, uploading, sir.
Yes. Mr. Nilesh, you can explain.
So this is a unified and connected and interoperable system which we are trying to talk here about. Second slide. eHealth system is an internationally patented technology which interconnects all healthcare service providers on one single platform. We create digital bridge between governments, healthcare service providers, and citizens. We create health information exchange. These services are available on web application, Android, iOS platform, e-health cards, digital cards, health wristbands, and ultimately we would like to provide dashboards to the government to draw a health index of the region, which will be helpful in designing new health policies. Next. So what we offer here is we would like to invest, install, implement, operate, and maintain the technology for the governments in a public-private partnership model. We would also like to create a continuous recurring revenue generation for the governments. We will integrate artificial intelligence and machine learning tools for healthcare data analytics of the country. We will provide health dashboard for the government by integrating all required health reports, connect all private government hospitals, healthcare ecosystem. And after connecting this, we should provide user interface through the web application, through the Android app, etc. The uniqueness of what we are offering is we have created health checkup unit, a portable unit, wherein 76 parameters can be examined, and we will be creating this door-to-door health checkup scheme, creating employment, generating opportunities for the Skill India development, the young boys and girls in every metro city, district, town, taluka, tehsil, and village will be in this health informatics value chain, creating value at every juncture. As earlier I mentioned, there are thousands of villages below 1,000 population. We will be providing advanced step of telemedicine. It's e-video clinic facility, establishing it in every village below 1,000 population. Next. So this is the understanding of the interoperability. This way, if we can connect doctors and clinics, public and private hospitals, diagnostic labs, medical records, ambulatory services, blood banks, pharmacies, telemedicine, organ registries, research organizations, government or private insurance, and citizens. All these connected to the government cloud, single point interconnectivity with various healthcare providers, Next. Next slide, please. So these are the benefits for citizens and the ecosystem. Prominently, we can give the health service. If I have to mention some of the few benefits of eHealth system for citizens, we will be providing them the BPO, KPO, health checkup. We can store their data on the cloud. We can connect them to the organ donor program. We can also connect them to the transplant centers. We can give them reminders, medicine reminders. We can also give them awareness about government policies, government schemes, government plans, any situation like COVID, any pandemic situation. We need to guide people and not just lock them down and lock the entire process of whole social structure, which is not advisable. If we have personalized health record system connected to the government dashboard, then every individual positively with security can be tracked, he can be monitored if necessary, he can be supported, etc. Next slide. So here we are with some of the acquisitions, intellectual property, some of the international patents, HL7 and HIPAA compliances. Next slide. So what we are trying to propose, this is the last slide. We are trying to propose the responsibility, accountability, not just by the governments, but on individual level. This global accountability regarding the 360 degrees healthcare. COVID is blessings in disguise. People are more aware. Technology will be more understood now. Self-reliant approach in the healthcare and personalized healthcare supported by artificial intelligence, creating this bioinformatics and its value chain, creating employment, analyzing the whole situation and reconciling it, real-time reconciliation. This will, I feel, definitely increase the SDGs as well as population health management, and then we can really consider that the entire society, because of the technology, the vision of our Honorable Prime Minister, Mr. Narendra Modi, and technocrats like Professor Moni and the platforms like Shobit University, they should do these kind of value additions and awareness programs very often, young boys, girls, and healthcare system should be enhanced, and the entire result should be good health, 360 degrees, good health for body, mind, and spirit. So thank you, Professor Moni, for giving me this opportunity. The time is short, things are, as they say, Vasudhaiva Kutumbakam. The concept is of the entire global healthcare activity, which should be pragmatically addressed, technologically addressed, and we all wish all of us good luck for this endeavor. Thank you, sir.
Sir, please unmute yourself. Professor Moni, unmute yourself.
Thank you, Mr. Nilesh Kanade, for your very wonderful, address to the audience of the International Webinar Series on Open Source Digital Technologies for Self-Reliant India, and the topic Health Informatics Network Value Chain, eHealth System and beyond. You have narrated very effectively the importance of 360 degrees health system value. And also you said it that the beyond means you have to bring a unified system, an interoperable system, a connected system between doctor and citizens. And this is where through open APIs in the digital world, you create a health informatics network value chain very effectively. The health informatics is not only related to human health related aspect, as you rightly said it, that about 858 diseases are come from animal to the human being. Means that having an integrated approach of one health, eco health is more important. And when I was asked to address the National Agriculture Science Congress held in Lucknow in 2012, I was asked to speak on integrated farm health information network for reducing the farmers' loss. When I talked about that, I was able to integrate a concept for integrated farmer health, plant health, animal health, soil health, water health, and fishery health. Now, the whole world is moving towards one health, eco health, and we are voicing from 2011 onwards this type of approach. And I'm very happy from your address and the journey which you have traveled from 2010 based on the declaration of WHO to establish health information exchange, HIE, based on standards with your colleagues, experts, discussing in New York and establishing a customizable e-health system for the world, which consists of more than 195 plus countries, developed, developing, and least developed countries. And Corona has divided the countries of the world like anything with respect to vaccine availability, vaccine accessibility, and vaccine reachability. And these are all some of the things that is very important to look into it. But your address today, it is something is very important for all the youngsters, youths who would like to establish startup by using all the digital technologies in the healthcare sector. On 23rd January, we had a very effective, important address by an NRI based at New York on the role of artificial intelligence for effective clinical and drug discovery research and so on and so forth. Today, you have given a 360 degrees view, you talked about that, how it can, by having an e-health system, even up to the village through e-video clinic for even population less than 1,000 in villages. There are umpteen number of villages in the country. There are about 2.25 lakhs villages, out of which many villages are having less than 1,000 populations. Even though Government of India has embarked upon a very important scheme of providing, BharatNet internet connectivity with gigabit speed to every gram panchayat, that is up to the level of 2.25 lakhs gram panchayat. But there are about 6.25 lakhs villages are there, and how to connect them, how to bring an e-video clinic to the villages it's both a challenge and an opportunity for us to bring it. And you also said it that you are creating a model which is operationable, can be operationalized, implemented through PPP model, which can generate KPOs and BPOs, and also skill development through Skill India 2015 and Stand Up India 2015 in a very effective manner. And this is where to create an interconnected unified healthcare system which is secure in nature, which is HIPAA compliant, and also that following all the declarative statements of WHO, a system is very important so that the common man can have a faith on the system, where his health record is secured, and it is visible only to the people concerned, not it is being sold. And this you have very emphatically and talked about it, that your e-health system which you have established and takes care of all standards and the guidelines given by WHO. And I am very happy that an NRI from India were able to visualize this problem 10 years back based on the WHO guidelines, and also with your own friends and experts associated with you were able to establish a system, and which is now it can be implemented in the very difficult situations today, and it is customizable. And I'm also very happy to know that this system can be customized in 15 days time, and that is more important. And it can be accessible through web applications, Android apps, iOS apps, and also to take care of even the school children. You have come out with a technology called wristband, which can carry health cards and e-health card. So I think you have come out with almost all aspects which you have mentioned very nicely, that that your e-health system is a benefits to the level of about 28 categories you have listed out very carefully, so that your system is transferable, your system is transparent, and also that there are 12 entities starting from citizen to insurance. It is a life cycle, and interoperable healthcare systems, and you also said it that our e-health system is a responsible e-healthcare system, a digital health system, and it meets the sustainable development goals for population healthcare system management. So I think today in our international webinar series on open source digital technologies for self-reliant India, as Government of India has given an importance in our union budget this time, the largest allocation is for health system in India. And also that they have recognized that the study and research in a connected system between human health and animal health is more important. We have gone one step ahead from the Subit University, that we have been now voicing that we also come out with the health informatics, blueprint, health informatics network with human health, plant health, animal health, soil health, water health, and fishery health. Is 360 degrees, aspect, which also includes health, animal, and environmental conditions like plant health and water health and soil health. So, from the university, we would like to very closely interact and work with you to establish the health informatics network for this country, and also for training, capacity building, competence building for our closely having countries who are having close relationship with government, with India and also other developing countries. That, and it is a very important sector, and healthcare informatics network value chain is very important. And I am very happy that I mentioned I was involved in putting district health component in 1987. From 1987 to 2021, it is another big milestone. And 2012, we put the health informatics with integrated farm health management. And this also figuring as a very important recommendation of doubling the farmers' income by 2022 in the digital technology in agriculture. And government of India has shown its direction. And now through the budget, it has shown in the direction. And experts like you, entrepreneurs like you have come out with an technology product for operationalization up to village level, which is having less than 1,000 population, through an e-video clinic. And the same e-video clinic should be available for even for animals. Farmer who has got even 2 cattle, which they cannot transport to nearby primary health center, because to transport, they need a truck, and they cannot even have an appointment. And if by the time they reach their primary health, animal health center, the doctor may be there, may not be there. So this can bring in a grassroots level revolution, and also that it can bring in, if we are able to bring in farm loss reduction, this itself is a big income revolution to the farmer. So, and on behalf of the Honorable Chancellor of the Soviet Institute of Engineering and Technology and Soviet University, Congo, and on behalf of the Vice Chancellors of the university and faculty members of the university, on my behalf, and as the Professor Emeritus and Chairman of Center for Informatics Development Solutions and Application and Center for Industry 4.0 Technology Studies and Application, we thank you, and we would like to have you with us to promote health informatics through our proposed Center of Health Informatics of the Soviet Institute of Engineering and Technology in a very effective manner. Thank you very much. With this, we close the seminar and we leave the studio. Thank you, Mr. Nilesh Kanade, and the team, which has made a very good presentation and also a very good video, which has given an important. There is one query from Ethiopia. Please, answer. Dr. Faiz Akram, what is the effect of health informatics on individual and how it helps for patient safety? Dr. Faiz Akram from Jumma University, Ethiopia. Mr. Nilesh Kanade.
The fundamental impact of health informatics value chain, we must understand health informatics is technology, knowledge, healthcare requirements brought together. While we bring these 3 factors together, we can reach and penetrate in the most rural terrain where it is really required. Metro cities, developed nations can have all these facilities as the infrastructure is available. But when you go down to B, C, D, and E class geographies, health informatics, technological aspects, products, employment, and reaching to the required person will happen. That's how the individual growth is possible. That's how the individual growth is possible. So impacts are immense. Impacts on each individual from the point of view of health, from the point of view of financial growth, from the point of ecosystem, healthcare ecosystem availability, and this will enhance the lives. Thank you.
To elaborate what Mr. Nilesh Kanade said it, Dr. Faiz Agram, I also would like to define health informatics as follows. Health informatics, as established, uses information technology to organize and analyze health records to improve healthcare outcomes. Rapidly evolving field and getting influenced by and impacting on many different knowledge domains. Nursing informatics, dental informatics, public health informatics, medical informatics, biomedical informatics, consumer health informatics, computational biology, telemedicine, electronic health records, data interchange through standards, and etc. etc. It means that large scale application of computer science and engineering and information technology through standards on health information will impact common public in a very positive manner, and it will be a transparent system, and it is and by those boys and girls who are having biological study, biology understanding, biology knowledge, and if they are trained for about 3 years on eHealth and health informatics, they will be a very good technical support between clinical laboratories and the doctor, because this system generates large scale data which has to be analyzed through AI and big data analytics, and also for disease tracking we have to have blockchain technology operationalized. Thank you very much for.
And with this, we can take the opportunity to get connected with the Ethiopian government as well.
That's true, and that's why I'm very happy. That's why Dr. Jumma University is now going to have a collaborative research association with Soviet Institute of Engineering and Technology. Dr. Faiz Agram is taking a leading step in this direction, because they have thought that by joining with Soviet Institute of Engineering and Technology on agricultural informatics, now in the health informatics, and also various research programs, they have taken a very leading step, and discussion is going on for effective collaboration between Jumma Institute of Technology, Jumma University, Ethiopia, and Soviet Institute of Engineering and Technology, Meerut. And I'm very happy that he has been participating, he and his faculty members and students are participating on every program on Saturday at 11:30 to 1 p.m. And I'm very happy about that. Thank you, Dr. Faiz Agram, for your.
Thank you. Okay.
Thank you.